Hi, everyone. I am really, really excited. I probably have said that at the beginning of every one of these videos that you've watched, but I'm just really excited about all these people that I'm getting to introduce to you. And Rachel Ross is our next guest. She is somebody who you most probably desperately need to go talk to, or a Rachel Ross in your area. She's one of those practitioners that you never knew you really, really needed. So, Rachel is a physical therapist, and physical therapists can specialize in a lot of different areas. And Rachel has specialized in pregnancy and postpartum, and most specifically in the pelvic floor.
Mhm.
Hopefully, you've heard some things about pelvic floor already, but I'm going to let Rachel tell us what the pelvic floor is about and why we need somebody to help us with it.
Thank you. I'm super excited as well. So I've been a physical therapist for 15 years, and I have specialized in this area for the last 8 years or so. And my journey into the pelvic floor world really started after I had my daughter Addison, who is 11 years old now. Um, During pregnancy, I really was like excited about having a baby, didn't even think about how to prepare my body. Went into that delivery not knowing anything, just like my body will do this, I'll figure it out, it'll be fine. And that was absolutely the wrong idea to have. I had a vaginal delivery. I had a third-degree tear, some tailbone pain, and my recovery was pretty rough. And as a physical therapist, I knew some of that stuff wasn't normal. But when I asked my doctor about it, my OB at the time, she just said,
Oh, it happens all the time. No big
yes,
deal.
yeah, it's normal. You just had a baby. And, in my mind, I was like, oh, okay, I guess. But then when I went back to work 3 months later, and every time I sat down on that stool to treat a patient, I had like immense tailbone pain. I'm like, this cannot still be normal after 3 months. And I went back to her and, she still said, oh, it's normal. And I was like, well, can I go to physical therapy? Like, taking that upon myself. And I didn't really know that there was a specialist out there at the time. And so when I went and called for my appointment, they said, oh, our pelvic floor PT is out on maternity leave, but we'll have you with someone who kind of specializes in the pelvis area. And in my mind, I was like, okay. So after that experience, and I did get better, I returned to exercise and started doing like jumping and running and all these like high intensity things that I thought I could do after having a baby. It was just like 4 to 5 months postpartum at the time, and ended up starting to leak, ended up having a prolapse, which I didn't know was a thing at the time. Um, so I was like, what is going on with my body right now? And again, went back to the doctor because I was like, I see something in that vaginal opening. Like, what is that? I've never seen that before. And she's like, oh, it's just extra tissue. Again, you just had a baby. I was like, extra tissue? Like, how does extra tissue just show up? Um, so then I'm like, okay, I need to go to a urogynecologist. Like, so I just did all this research and just felt like so lost. And then I realized after doing my own research, like there is a specialty in pelvic floor PT, and I knew that I needed to dive further. And when I took my first continuing ed to really specialize, I fell in love. I was like, I need to share all this information with everybody that I know because it's so important and it changed my life. So that's kind of how I got into pelvic floor PT. I've worked for a hospital system my whole entire life. And 2 years ago, I started my own business, Infinite Joy Physical Therapy, here in Marysville. And never in my life did I think I would do this journey on my own, by myself, but it was my patients telling me, you should start your own business. You need to help people. You're different, you're special. And I'm like, I'm just doing my job and doing what I love. Um, so just these past 2 years have really shown me like this, what I do is important and people do need to know um, this information and what the pelvic floor is and why it's important. So,
I think that's, I mean, as you're talking, you really mirror like what my story was and where I got my passion. I think some of us are meant to walk through
mhm,
a specific path because then we get a choice. We either
mhm,
get the blessing of using it and helping other women either prevent walking down the same path that we were on or assist them on the other side or as they go.
mhm.
And it becomes a driving passion
Yeah.
to, it's so hard. I don't know, I'm sure you see this all the time where women come to you. One, as you were speaking, one is a friend of mine who had a prolapsed uterus after delivery. And of course, they told her, This can never be fixed. It's just
Yeah.
something you have to live with." And that's crazy.
Yeah.
Think about how many women are being damaged
Yep.
daily. They're losing their vitality. They're being robbed because of the energy that it takes to be in pain
Yep.
or to manage something that is atypical in the body when things are not where they're
Yeah.
supposed to be.
Exactly.
It's awful. It's awful. It's a crime. And
Hmm.
I love that you're using that. And that is what makes you special. It's a big part. I'm sure there are many other reasons of why you're special, but a big part of what makes you special in that situation is you've been there.
Yep.
You've walked in those shoes. So it's very different. I know, like from a male doctor, I don't mean to pick on men, but
Right.
if you go to a male doctor for women's issues, they may have studied, they may be a really smart person, but they have never, ever walked where you're walking as a woman.
Yep.
And it's a disconnect. It's a disconnect when you're just somebody who read a bunch of things about an issue
Yeah.
and you're gonna do stuff. Ooh, so I love that. You talk about your journey at the end.
Hmm.
So are there things I think about, are there things that somebody could benefit? We think so much about going to the doctor or a practitioner after things have broken or fallen apart.
Hmm.
Are there things that if somebody got into working with a pelvic floor expert before pregnancy or during pregnancy that would help prevent the
Hmm.
problem? Is that something that you can help with?
Yeah. I do feel like it starts during pregnancy. Your body changes so much during pregnancy and just specifically how the hormones play such a role. I mean, I'm just scratching the surface in my knowledge and hormones and how they do play a role, but they, create this laxity in our joints or looseness in our joints, specifically the pelvis, because you're trying to prepare that body for the growing baby, the expanding uterus. So the pelvis widens the tissues around the pelvis. So the pelvic floor is the whole bottom part of the pelvis. The core muscles wrap around the pelvis. And it's that little stability system of those muscles that really hug and support our pelvis. And you have this growing baby. So your abdominal muscles start to stretch outward. Your pelvic floor starts to stretch downward. And again, that's all part of the normal process. But that stuff doesn't go back to normal right after you deliver a baby, like we're told. I mean, there's this expectation that society places on us to bounce back after having a baby, and that is not, it's truly not the case. And I mean, I have goosebumps right now because I just get so like,
Physically not possible. It's
yeah, it's just
physically
so
not possible.
mad.
It's
But
not reality.
yeah, and with hormones, obviously you're diving into all of that, but your hormones are just changing throughout the postpartum journey too, and breastfeeding and like all the things. So it's not possible to bounce back. So starting in pregnancy, whether you have pain in pregnancy or not, like I'm really starting to see patients come to me without pain and they're like, I just want to prepare my body. I want to know what I don't know. I want to know how I can have a better postpartum recovery. And I freaking love those patients so much. Like they're just they
Thinking
want to
ahead.
learn, they're sponges, and it's just amazing. It makes me so happy. Um but just starting in pregnancy, like learning the anatomy, like what your pelvic floor is, what your core is, how they work, how to activate them. That's such powerful information, just knowing where your pelvic floor is and how you can have control over it. So in the early stages of pregnancy, first, second trimester, you're working on building strength in the core and pelvic floor. You're working on breathing mechanics, making sure that the breath system is fluid and moving, and you know how to breathe because you need that for delivery, whether it's a vaginal or a C-section, and you need that for postpartum recovery. It's addressing any pain, and it's helping people and through exercise, right? Like, because people are scared to exercise sometimes when they get pregnant, because again, they're
Yeah.
told you're pregnant, you can't do anything.
Yep.
It's not true, right?
They're
Yeah,
told you can't touch any herbs either. So
yeah,
I hear
right.
all of it.
Yeah, it's just so people get confused because they're like, well, I don't know. Like people say yes, people say no. So I get to guide them into, movement and exercise and just really help them to feel confident that they're doing, the right thing for themselves. And then in the third trimester, we start kind of switching up to like birth prep. I've learned so much about birth prep, and I know it's just, again, scratching the surface, but teaching patients like how their pelvis moves during delivery and like how you can facilitate a more open pelvis versus a closed pelvis, and kind of the traditional way of delivering a baby vaginally on your back, right? Like I
Terrible.
went through it. I
No.
didn't know any better. Like I'm just doing what the doctors tell me to do. And clearly it didn't go well. For my body anyways. Obviously I have my daughter and that went well, but
Yes.
for my body. um, so like just again, teaching them different positions that they can get in, whether they do have an epidural, not epidural, a home birth, a hospital birth, like not like you have power, right? Like you can tell your doctor or the nurse, like, I want to move around. I know I had an epidural, but I can get in this position with your help. And I want to do that. Because I think we're so scared to speak up for ourselves.
Yeah.
And I really love that patients are now learning more about doulas and midwives and really that birth prep education and like how to empower themselves in the delivery room.
Yeah, and I think that sort of having somebody explain what is
Yeah,
happening and understanding how those joints are flexing and why,
yeah,
if things aren't working, you can sort of visualize better why I'm getting into this position. Oh,
yes,
that position, I even feel my hips closing up. I know that's pinching and that's not what I want. But without that information,
yes,
you you're clueless. And what it does is it makes you dependent on somebody else. And
yes,
it does make you dependent on just, well, I have to do whatever this person says with
yeah,
the white coat because I don't have any information. And even though I feel like this is wrong or I could do something, what do I know? And
yes,
that's so sad. It's so
yes, it
sad.
really,
We should
yeah,
be listening to that when we're birthing uh, immensely.
yeah,
And everybody else should just fall to the wayside and listen to that. Uh,
yep,
but women have sort of, well, we've definitely lost our power in the
yeah.
birthing room. And that's a big problem. And knowledge is key. Knowledge is key. What kind of injuries do you see uh, that pelvic, well, I guess pelvic floor can treat
Hmm. From birth or just in general, or
in general? Like what are some things I think the average person would be who, even if they know about
Mhm.
pelvic floor folks, I think they may be shocked to think about all the things that
Mhm.
this touches because your pelvic floor is kind of important.
Yeah. Okay, so I'll kind of just go through a whole list of common symptoms that have to do with the pelvic floor. So most common would definitely be your urinary incontinence or leakage. So stress incontinence is when you leak with laughing, coughing, sneezing, jumping, lifting, like something that creates pressure on that bladder. There's urge incontinence where you leak when you have urgency to use the bathroom. And then mixed incontinence, which is a combination of both. Urinary urgency with or without leakage is also a very common symptom where you feel like you have to go to the bathroom, constantly like having that sense that you have to go or that urge, going just in case to the bathroom, having like or knowing where the bathrooms are like everywhere you go. I've had patients where they've like mapped out their grocery store and like, Meijer or whatever because they know where all the bathrooms are. Um, Frequency, feeling like you have to go all the time or going all the time. Like if you're going every hour and a half, even every 2 hours, like normal ranges to wait to go to the bathroom would be like 2 to 4 hours. So if someone's going more frequently, that can be a sign something's going on in the pelvic floor. Um, Difficulty with urination where you feel like you have to strain or like push your pee out, or you feel like your stream kind of like starts and stops and it's not smooth. I feel like the straining one will get a lot of people because I do hear people like will strain to pee and they're like, what? I'm not supposed to do that.
Well, you
So
don't know. I mean,
right.
we don't talk about these things openly.
Right. And like the rushing too, like, oh, I have to, my kid's yelling for me, or I have to get this phone call, or I have to run here or there. Like, so you're trying to rush and you're just like pushing it out. So no, you should, I always say to my patients, go to the bathroom like a man. Just sit in the
Oh,
bathroom and close the door for 2 hours, right? No, not
yep.
that long, but just relax in the bathroom. Um, I would say another kind of common and maybe symptom that people don't really realize would be recurring UTIs.
Mm.
Um, Whether you have the actual infection or not, a lot of times people have the symptoms of a UTI, but without the actual infection. And that can be a sign that the pelvic floor might be like too tight or just not working properly. I've had tons of patients where they are constantly going to urgent care or primary care and taking antibiotics and still having the pain. And, they somehow come to me, get to me, and I'm like, it's your pelvic floor. And they're like, oh my gosh. And
And it
they're,
can be fixed.
yeah, and it can be fixed. Yeah, it's
Yeah.
amazing. It still amazes me every day. Um, Prolapse, we touched on prolapse just a little bit. So you can have a prolapse of the bladder, uterus, rectum, vaginal wall, intestines. A prolapse just basically means it's a change in position in one of the pelvic organs. And it's usually because the support system of those organs are stretched or weakened, or that vaginal wall is stretched or weakened. Usually I have my pelvic floor model. I have a 3D model that I use. So I'm
I
like,
caught you at home today.
yeah, yeah, all good. But I have a model that I show patients, so they can kind of see like what's going on. But um, prolapses sometimes are painful. Sometimes it's more of like a bulge or a pressure that they might feel. Sometimes they might have difficulty with urination or bowel movements, just depending on what's prolapsed and to what degree. Um, Bowel movement wise, so constipation is a big one. I think that constipation is just a big blanket term, but if someone's having difficulty going to the bathroom where they feel like they're straining or pushing or feeling incomplete or like they're not getting everything out, that can be a pelvic floor thing. Um, Sometimes too hard stool, too loose stool, that can pelvic floor can play a role in that. And then on the flip side of difficulty with bowel movement, you can have fecal incontinence where you leak or can't control gas. or feel like you're wiping and trying to get clean and just constantly wiping and it's um, not doing well. Um, Pelvic pain is a big one. So that's just a big term for pain somewhere in the pelvis. It can be pubic bone pain, it can be vaginal pain, it can be tailbone pain, rectal pain, hip pain, lower ab pain, like just kind of anywhere around the pelvis. And sometimes that would mean that the pelvic floor could be too tight or not working correctly. Um, Pain with intercourse, pain with tampon insertion or wearing a tampon, pain with a menstrual cup, pain with an OBGYN exam. Those are also big, big signs that something's not working correctly.
And you're listing a lot of things that people tend to, I love to point out to women that dysfunction has been normalized,
Yeah.
but it is not balance.
Yeah.
So a lot of times a woman will say, yeah, I'm having pain,
Mhm.
or I see a lump of flesh that wasn't supposed to be there anymore. And
Yeah.
the doctor will say, oh, that's normal.
Right.
And what they're really saying is, I see a lot of that. I
Yeah.
see a lot of that correlating with where you are in your life history or what you've done. And
Yep.
so it's normal. And
Right.
not, it's not the design. It's
No.
not a normal function, and I hate the word normal.
Yes.
So I like to leave normal over on the bad side.
Yeah.
Balance does not look like that. And if you're not in balance,
Hmm.
there is usually, you may not have met them or heard of them yet, but there is usually a professional that can help you get back into balance. And we've just been taught to accept
Yeah.
the imbalance by the word normal. Oh, that's normal. You'll just
Yep.
live like that forever.
Yes.
Oh,
Ah.
don't live like that. You don't have to. Go to somebody that can help. So tell us what a typical appointment with you would look like.
Yeah. So I spend an hour to an hour 15 with my patients on their first visit. I feel like you just really need time to let the person tell their story because they're in and out of a doctor's office in 5, 10 minutes, and there's just so much more to their story. So I personally really like listening and hearing them list all the things that they've been dealing with, whether it is pelvic floor related or not, but just someone to listen to their story. So we have plenty of time to chat. I always, you know, go through my pelvic floor list, ask my questions, and usually we'll find another symptom or two in there that they didn't even realize was related. Like I said, I have my 3D pelvic model that I show them, the anatomy of it, how it works, try to relate the anatomy back to their symptoms so they can kind of get a visual of what's happening. And it's so cool. It's one of the favorite parts of my job that I just see that little like click in their eye or their facial expression when they see and can put it to, what's actually going on, like, this is it, it's really cool to see that. Um, I always evaluate posture. I evaluate breathing, like how a person is breathing, how their rib cage is moving. I'll assess core strength and function. I'll assess the pelvis and the hips, look for strength, alignment. Um, and then I assess the pelvic floor if the patient is comfortable with it. An assessment of the pelvic floor typically requires an internal assessment. So I'm checking the muscles internally just with a finger. I'm not using, like the speculum, or people are not up in stirrups or anything crazy like that. They're just comfortably laying on my mat table, covered with a lovely twin size sheet, not that small little paper sheet that tears and rips in all the wrong places anyways. And it's just all about comfort. But what I'm checking for when I check the pelvic floor is any tenderness. So just like a muscle like on your leg or in your neck. If it's pushed on and it's like, oh, that's a tender spot, that can happen in the pelvic floor. The pelvic floor could have trigger points. So I'm checking for those things. I'm checking for balance right to left. Does one side, feel tighter than the other side? Even though the pelvic floor is this little bowl, there's still like right and left differences. Um, I will check for sensation, and then strength. How is the patient contracting or doing a Kegel? I hate the term Kegel, but most people know that
That's
term.
a whole conference in itself.
Yes, it is.
Kegels,
Yes, it is. Ah, so how to
mostly done
confirm.
wrong.
Yes, yeah. Oh, 100%. But that's why an internal assessment is important to bring that awareness. Like I can feel the pelvic floor contract, I can feel the pelvic floor relax, but can the patient do that? And most people don't have that awareness of this is what it feels like to be contracting, and this is what it feels like to be relaxed. Most of the time, there's an imbalance in the pelvic floor. I mean, you said balance is key, right? Like, well, it's imbalanced in the pelvic floor. You can have a stronger right side, a stronger or weaker left side. You can be weaker in the front and stronger in the back. And this would all make much more sense if you saw my muscles. But there's a lot to assess with an internal assessment. Or excuse me, there's a lot of information I can gather with an internal assessment. And really, I can do that within like a 5-minute time frame of 3 to 5 minutes checking the pelvic floor internally. So yes, it's uncomfortable, but it's not as uncomfortable as a gynecologist, I think. And it's way more relaxed and you get so much information out of it. And I don't always assess the pelvic floor on the first visit. I kind of, read my patients and I can tell if they're like, that's not going to happen. But I make sure they know, like, okay, if your symptoms are not getting better in X amount of time, then we need to assess the pelvic floor and we'll decide together when that is appropriate.
Yeah.
Yeah.
So, what kind of therapy then is there? So you find an imbalance in the pelvic floor. What kind of instructions or things are you
Mhm.
sending the patient away with?
Yeah, well, it depends on the patient and their goals and, the other dysfunctions, but all my patients learn how to breathe. Doesn't matter if you have hip pain or you're leaking or you have headaches, like you are learning how to breathe because your diaphragm, your breath system works with the core, works with the pelvic floor. And if you can't breathe properly, then those muscles are not going to function properly. So we spend time on breathing, learn how to connect the pelvic floor with your breath. It's so common that when we do Kegels, we suck in and contract everything with all we've got. But it's really you contracting the muscles, the pelvic floor on an exhale, not an inhale. And that blows people's minds. So it's kind of undoing what they've learned
Yep.
to do and
Yep.
redoing it. We do a lot of undoing and a lot of redoing in my office. So,
So, I mean, this is a great moment to mention you also you have a yoga studio that you are adding into your portfolio because I mean, it would be almost like you're prescribing, hey, go downstairs and take a yoga class.
yeah,
Because there are so many people that are taking yoga that don't really understand this whole why am I sitting here breathing in this
yeah,
space? And then so many people that need to work on their pelvic floor that don't truly understand how to incorporate into life.
yeah.
So I love that you've got that synergy now to be able, I prescribe walk out the back door and eat this weed. And so my farm is really important for that, and you're incorporating that together.
Yeah.
So beyond breathing, are there exercises that people can be doing? Like, do you send home sheets with, work on this to get the prolapse to start working better? Or
Um, yes and no. I mean, it's not a blanket protocol for everybody. I really try to teach them how to use their pelvic floor in a functional way because you're not going to be able to contract it or do a Kegel every time you go to pick up your kid or pick up the laundry basket, like your pelvic floor just functions on its own naturally. That's the part that gets lost through all of this, is that natural ability of it to work. So teaching the patient how to put it into function, and that could just be practicing an exhale as you lift your kid, or practice lifting your leg while you contract your pelvic floor, or squat or jump. It's very
It's new muscle
tailored.
memory.
Yeah, yep, new
Okay.
muscle memory for sure. Um, and then making sure the core is coordinating along with it, because I think, again, we're taught to suck it in and look thinner, and that's not how our core should be working either. So,
So my understanding as I've begun to talk to more pelvic floor specialists is a lot of women get really frustrated. They want their body to look a certain way, and they do
mhm.
9 million crunches, and
Yeah,
it still doesn't look the way that they see airbrushed on the movie and the magazine. But if your pelvic floor isn't healthy,
hmm,
and you're not using the pelvic floor effectively when you're doing
yeah,
a sit up. I'm going to put a commercial in here, and you can verify whether this commercial is correct or not. But my sense is that unless you retrain your pelvic floor to be healthy, your crunches and your sit ups and all the things that you're doing for a healthy core is going to be really limited.
yeah, yeah.
And okay,
True.
good.
It's
So,
very
and
true.
and then we're going to touch throughout this summit. The folks that are watching this video are going to see other practitioners. You're going to see chiropractic. You're going to see other pelvic visceral massage folks. And when you start to put all of this together, if your pelvis is aligned appropriately and
Hmm.
you're doing chiropractic, everything starts to stabilize. And
Yep,
instead of like throwing yourself at this wall of fitness, and I have to look a certain way and I have to do this, and I'm going to be fit and muscular, but your muscles are exhausted
yep,
because they're not doing the right function.
absolutely.
So it seems to me that if you wanted to have those beautiful abs, that this would be a really good foundational
Oh
place.
yeah.
So,
I
do,
don't know how many people tell me on a daily basis, like, I've never contracted my core this way. Like, where
mhm.
were you when I was an athlete, And it's just so simple to reconnect. Not simple, but, it's just reconnecting.
It is simple. It's like everything that I do. It's so simple. It is dead simple what this is.
Yeah,
But because we're so far away from the common knowledge of it and how to care for our bodies and what our bodies are,
yeah,
we're so disconnected that the simplest basic thing can be the most complicated, difficult thing to achieve.
yeah,
And that's why we need help.
yeah. Yes.
Yeah. So would somebody come back to you often as they're going through? Is it a therapy, or is it you're kind of
Yeah.
assessing how they're doing their work?
So I would say it's not your traditional like 2 to 3 times a week for 4 to 6 weeks and you're done. We start off with once a week, because I want to make sure that what we're doing, and whether it's a manual therapy or an exercise, is working for you, and you're be able to do it, and you're able to kind of like see improvements, right? Like, one exercise I give you might not work for the other person. So again, I don't just have these same exercises that everybody does. So it's making sure that things are working, you're seeing improvement. Usually I see my patients once a week for about 4 to 8 to 12 weeks, and then we'll start to like stretch it out
Okay.
every other week, once a month. I would say my postpartum moms are starting to come in at somewhere between like 4 to 6 weeks postpartum. We'll work together for like a month, and then life gets busy, right? Like, you go back to work or whatever, and you kind of forget about yourself. And then they'll come back like 6 months later when they're feeling better, have a routine more down, and are ready to get back into more exercise. So I feel like since I've started my own practice, it's this revolving door. And I love that, because it's just like primary care. You're going, once a year, or the dentist or your chiropractor. It's not just a couple times and you're done. Like, you're constantly working on your body. I have a couple patients that come in once a year for their pelvic floor check and making sure that they're on point, especially as they get into their older years.
Yeah, so let's touch on that real fast. Are there things that you can do for young girls as
Yeah.
they are starting out in puberty? And are there things that, you've got women who've moved into menopause, they've had their children, they've lived with urinary incontinence forever, and probably now think, oh, well, it's too late for me, even though I know I could do something, it's too late. Are
Yeah.
there things for both of those people that you can help?
Yeah, so I've worked with a fewer young girls, mostly athletes. But as my daughter is 11 and approaching that puberty stage, I'm like, how am I going to help her understand her body? Because I don't remember, having that talk or it being like, oh, you're just getting your period and that's it. So I feel like just starting to educate these younger girls on their anatomy and the pelvic floor and what it is, what it does, why you have your cycle. Just again, the more you know. So preparing those younger women. We talked about the pregnancy and postpartum stage. The perimenopause stage is my age right now, and I'm feeling that like your hormones are starting to change. And that does affect your pelvic floor as your hormones fluctuate. It changes the elasticity of the muscles. Like think of a trampoline. You have a nice tight trampoline that's very bouncy. As your hormones, your estrogen and progesterone start to decline, that trampoline gets a little bit more less bouncy and saggy, if you will. So the perimenopause and postmenopausal women, it's it's making sure they have the right strength in their muscles, building that strength so that when they do have those um, laxity symptoms, they're prepared and like ready to go on to their next phase. As we age, we lose strength, and if you're not already doing exercises to build that strength, then symptoms are going to really come on in that postmenopausal time frame. And I would say the most common symptoms postmenopausal is going to be leaking, bladder urgency, painful intercourse, and just pelvic pain and
So,
prolapse.
so I'm hearing, maybe an assessment with a young girl to help her understand, like feel where a contraction should be for pelvic
Mhm.
floor and understand the health
Yeah.
of that as she's moving into the next phase. And then for the menopausal, that whole umbrella, uh,
Hmm.
there's always, this is what I would say, there's always time
Yeah.
to live your most vibrant life.
Yeah.
There is always time. Our body is designed to heal. There is always time. If you're willing to put in the work,
Yes.
um, and really plug in and understand what it is that you're doing. Do you have anything else that you wanted to share in particular?
Um, just going back to what you said about the whole normalcy, my motto is it's common, but not normal.
Yeah.
That's what I really like to drive home with my patients. Like it's common, like you're okay that you feel this way and that you're frustrated. So know that
No.
it's common, but also know it is not normal. And I think that's like the big thing that I want people to know. It's not normal. You can
Yeah,
find
it's
help.
just not. Your
Yeah.
uterus isn't supposed to be slung over your
Yeah.
left shoulder. It
Yeah.
doesn't belong there. That's not normal.
Yeah.
Yeah. So if somebody wanted to book an appointment with you and get in touch with you, how would they do that?
They can visit my website. It's infinitejoyphysicaltherapy.com, and there is a place on there to put their name and number and email and their information. Yeah, just a second, buddy. They can also visit me on Instagram and Facebook. And I usually call or email them back and let them know. Hold on, just give me 1 second. Call them back or email them and we'll chat on the phone because I like to kind of explain the process, because not everybody understands all of it. And then we'll figure out a time that's good for them to schedule.
And your office is in downtown Marysville, Ohio.
Yep. It's
And
above
so
Pulse Yoga
you
and
get,
Fitness. Yep. It's in the Lofts on Main building. So
and
that's
it's not a medical building. It is
no.
so peaceful. Your offices I haven't walked into yet,
Yes.
but where your office is located is in an upstairs
Yes.
room, and it is a really peaceful, quiet
Yes.
place where you do not need to feel like you're on display
Yes. Very
while you are
private.
working on this. So, well, thank you so much for joining me,
Thank
Rachel.
you.
And I'm excited for so many people to see this and have that aha moment
Yes.
when we see ourselves and something that we have just accepted as part of our life, and we see that there is actually a solution. It is, well, it can be frustrating because we've lived with it for a long time not knowing, but it's also exhilarating to know that
Yeah.
there's a path. So thank you so much for
Absolutely.
sharing.
Yes. Thank you. Thank you.